Morning, everyone. Hope you guys are having a great Thursday, having a good week. We'll give a couple minutes for people to hop on here. And Facebook redid their system, so I'm trying to get familiar with it here too. Right. 30 more seconds, we'll get started. All right, guys. For those that don't know me, I'm Dr. Ben with Pro+Kinetix Physical Therapy and Performance within Truve. Today, we're going to be talking about sciatica. It's a very common diagnosis that we see. I'd say probably definitely top 5, maybe top 3 thing that we see and we treat. It's actually a relatively, people think sciatica is difficult and generally difficult to treat. It's not if you have the right assessment and you know what the issue actually is. A lot of times, we're going to talk about this a bit later. Sciatica can be caused by it can be coming from a couple different areas. It can be coming from the low back. It can be coming from the glute. It can be a nerve tension issue. And a lot of times when people are trying to attack sciatica and fix it, they are actually targeting the wrong area. Usually there's those three different areas that could be causing it, and people are just kind of guessing what area it is. And so what we see a lot and what our patients tell us is they're like, yeah, I thought it was coming from my low back, so I did a bunch of exercise for my low back, and it wasn't helping. And then I jumped around and I got discouraged. Well, what happened was because they were getting discouraged, they weren't doing enough frequency and duration with regards to the exercises. They were on the right track, but they didn't have the right dosage. And so it's not only narrowing it down to what's causing it, but then doing the correct exercises, finding the correct exercises. But that's only half the battle. Then you also have to do the right reps and sets and frequency. And that's where a lot of people are missing that. So we have a lot of people that come in and are stating that they've already done certain exercises for it. Like they come in for an evaluation, we do that, we show them exercise, like, well, I've already done this exercise before. And what happens is, I'm like, okay, well, how long were you doing those exercises for? And it turns out they only tried it for about 1 week, and they were doing it every other day. And that's just not enough frequency or duration to notice to see if something is actually helping or not. So we've improved their frequency and duration, and they were able to decrease their pain because of it. All right. So that's kind of the nut and bolt of sciatica and the different things that can be going on. But we're gonna go deeper into those 3 different areas that can be that sciatica can be being caused by through the anatomy. So, like I said, we can have sciatic pain coming from the low back. Right. So we have in our spinal column. So this is my low back. Okay, we have a curvature. Here, and out through the back of this is the front spine. This is the back. On the back side of the spine, we have nerves. Okay, that exit the back. And what can happen is over time, we can have a bulging disc. We can have nerve pinching because alignment of the spine. It can compress down on a nerve as it exits the spine and cause pain down the back of the leg. All right. And so a lot of times we have to make modifications to figure out, is it core weakness? Is it the alignment of the spine? Is it the disc bulge? And then also furthering narrowing it down from there, okay, making sure we're on the right track. It can be also coming from a tight piriformis. So the piriformis is a small muscle in the glute. It's located underneath the 2 big glute muscles, the glute maximus and glute medius, 2 very large muscles. This piriformis is very, very small in relation to it, okay? And so when the big glute muscles aren't doing their job, that piriformis is going to become overworked and tight, and what it's going to do is it's going to actually tighten up and compress on the sciatic nerve, because the sciatic nerve travels underneath that piriformis. Okay, and so when that gets tight, compressed on the nerve, and we get pain down the back of our leg. Okay, so a lot of times people are like, oh, well, just loosen up the piriformis. So what they do is they do a lot of stretching and foam rolling, where they get relief for like a day or two, but then it comes right back. And that's because they're really just treating the symptoms. They're not treating the root cause. The root cause is actually the glute weakness. So you actually have to strengthen up the glutes. Okay, but that's kind of the second phase. How we do physical therapies, there's 3 different phases. There's phase 1, we obviously want to decrease the pain and symptoms that someone's having, and we can do that through getting the muscles to loosen up and relax and take off that tension, and people get relief. However, that's just that first phase. If we don't do anything more, that pain is going to come right back. Phase 2 is where we start strengthening up the muscles that are weak, and that's ultimately leading to the tightness, which ultimately is leading to the pain. So we get relief through soft tissue work, such as foam rolling, stretching, stuff like that. But in the second phase, we need to strengthen it up so we don't have to keep doing these, all this foam rolling and all this stretching to correct it. Okay. And then phase 3 is usually transitioning into more of a strength training program that's tailored to that individual patient. So that's kind of another area, that piriformis, right? It can be also caused by a lot of sitting, okay? Because that changes the low back positioning, also can make the glutes and can get irritation from the chair on the back of the legs and kind of in the glute area too, which can be leading to sciatica. Lastly is nerve tension, okay? So our nervous system is all interconnected, okay? All the way through the brain, all the way through the spinal cord, all the way through the nerves, all the way down into the feet. And what happens is that our nerves actually travel in connective tissue, which is kind of like a sheath, okay? So we have like a tunnel, and that nerve travels through that tunnel. And anywhere along that continuation, that connective tissue can adhere down to the nerve, okay? And nerves don't like to have anything attached to them. They actually need to be able to glide in and out of that tube as we move. So as I bend forward, if I straighten and bend my leg, if I bring my foot up, point it down, my nerves actually have to glide as I do those movements. And if there's any adherence down to those or anywhere along that continuation, it's going to stretch that nerve because it's adhered down at one end, and you're trying to move it at the other end, and it's causing irritation and pain. Okay, so that's another cause of sciatica and nerve pain as well. Don't get me wrong, it's not always just one. Sometimes there's 2 out of 3. Sometimes it's all 3. Okay, and so that's why some people will be targeting one area and just neglecting the other 2, and they're thinking it's not getting better. Well, it's only because you're targeting a third of the problem when all 3 are causing issues there. Okay, so super important to assess, don't guess. All right. See, so many of our patients come in. Yeah, I tried doing YouTube videos for a month or 2, and nothing seemed to help. And a lot of times they actually report it made it worse. Okay. So those are the 3 different areas that can be coming from. Okay. So you're probably wondering, like, what can I do about it? All right. So improving the alignment of the spine and getting the disc, if there's a disc bulge, getting that to go back in. Okay, a lot of people are like, well, if it's a disc bulge, it's like permanent. No, it's not. A disc bulge is not permanent. It got there in one way, it can be reversed. Okay, and a lot of times the body actually just over time absorbs that disc as well. But we can speed up that healing process through different exercises and movements and stuff. And then with regards to the piriformis tightness, we need to loosen up that piriformis, strengthen up the glutes. And then with regards to the nerve tension, we need to be doing nerve glides. And we're going to be going over exercises, 1 exercise for the back, 1 exercise for the piriformis, and also 1 exercise for the nerve tightness. Okay. So what I want you guys to do is we're going to kind of test and kind of get an idea of where these limitations may or may not be. Again, I don't want you guys self-diagnosing yourself, but this can give you an idea of where you're at, okay, and what may be causing some of these issues, okay? So the testing that I'm going to give you guys is actually also part of treatment, okay, based on how you respond and what you're feeling with these, okay? So what we're going to do is I'm going to show you first how to loosen up that back. Okay, this isn't a test yet. We're going to get into testing for the nerve tension tightness as well as piriformis tightness. Okay, so one of the best ways to loosen up and get that back to feel better is actually just movement. The spine loves movement. And if we're not getting movement, then we can start getting quite a bit of pain and disc irritation. Okay, so you should be able to see me there. So what you're going to do is you're going to get into all four position like this. Right, and what you're going to do is you're going to start with slowly arching your low back, okay, and then you're going to slowly round, and you're just going to do small oscillations of this, and then as you get comfortable, more and more comfortable, you can get into more of the extreme ranges of motion. Okay, so you can see really arching that low back, and then really trying to round it out. Okay, and you can just spend 2 to 3 seconds at those more extreme ranges of motion. And do about 10 reps each direction. This is a great exercise for people that have just general low back pain, even if it's not sciatica, especially if we've been sitting at a desk for a long period of time, or just sitting in general. A lot of people are sitting at their couches now doing work, since everybody's working. A lot of people are working from home now, and so that low back can get pretty darn stiff. So this helps just reposition and lubricate those joints in the low back. It can help reposition that disc back where it needs to be. Let's do one more each direction. Good, and relax. When you first start out with this, make sure you're doing like small oscillations, and then as you get more and more comfortable, you can start exploring more of those extreme ranges of motion, okay? So this next exercise is going to help stretch and loosen up that piriformis, okay? So what you guys are going to do is you're going to lay on your back. Actually, let me point this slightly at an angle here. All right, you're going to lay on your back. What you're going to do is you're going to cross. Actually, let's do a test first. Okay, I'm going to give you guys 2 tests here. Okay, so what you're going to do is you're going to bring your legs up like this in a tabletop position, and then from there, what you're going to do is you're going to try and bring your feet apart without moving your thighs, and see how far you're able to go. Okay, and notice and make a note if one seems further out. Like if you guys look at my feet here. Okay, you see how my right side is able to go much further than my left. That would be indication of a tight piriformis on that left side, okay? Because that piriformis is responsible for rotation at the hip. And so what we're doing is we're getting actually rotation at the hip by going out, okay? However, if that piriformis is tight, it's going to limit movement as well, okay? So if you notice one side is tighter than the other and you have pain on that side, most likely part of the issue is the piriformis, okay? So you're like, okay, well, what can I do about that? And what stretch can I do? So what you're going to do is you're going to cross this left leg over the right, okay? And then you're going to try and take this left knee and drive it to the right shoulder. Okay, we should feel a nice stretch in this glute area. Ideally, you want to hold this for about 30 seconds. And ideally, you want to be doing 3 sets. Same thing, 3 sets with that other exercise we did. I'm just going to go through one just for time purposes, so I want to get through as much exercise and give you guys as much variety as possible. All right, let's go and switch to the other side. Same thing. Okay, we should feel a nice stretch in that glute area. And then, yeah, and just make note if one side feels tighter than the other with this as well. A lot of times when people are having sciatica, they feel a significant difference from side to side. So this is treatment as well as a test. All right, and relax. Okay, so next thing we're gonna do is we're gonna test and see if there's any nerve tension issues going on, okay? So what we're gonna do is I want you guys to bring your leg like this, okay? And you can grab it here, and what you're gonna do is you're gonna point your toe down, okay? Keep your toe pointed down, and then you're gonna bring it up until you start feeling a tension kind of in your hamstring. And then from there, what you're gonna do is you're gonna try and bring your toe up towards your head, okay? If you feel like if there's more tension, if you notice an increase in a stretching feeling, okay, that tells me that there's most likely some nerve tension issues going on, okay? Because the hamstring attaches right at the knee up into the glute. When we're moving our foot, we're not influencing that hamstring at all. All we're doing is actually moving that tendon through the sheath that I was talking about earlier, okay? Because it attaches all the way down to the toes. So when we bring our toes up, it actually puts more tension on the nerves. It doesn't do anything to the muscular system up here. But a lot of times people will feel more tension through that hamstring and kind of in the back of the knee if they have nerve tightness issues, okay? And you can do a couple reps. So this is also treatment as well as testing. So what you do is what term is called is flossing. Okay, we're flossing that nerve through that tendinous sheath. Okay, so you want to keep that knee at that same angle the entire time. Okay, you do about 15 reps of this. Nice and slow. You don't want to be going super fast with this. If you guys want to make it more, if you guys want to see experience something kind of cool, is I told you like that nervous system is connected all the way from the brain through the spinal cord to the nerves all the way down to the foot. If you guys actually bring your head up, a lot of times you'll feel an increase in tension because again, now we're stretching and lengthening the nervous system up the chain, okay, which also influences down here, okay? And you're just gonna do the same thing on the other side. Test the other side, okay? And see if you notice a difference. Okay, so again, you're just bringing your leg up to 90 degrees, then you're trying to straighten your leg until you can't straighten anymore because of tightness. And what you're gonna do is you're gonna bring your foot up, point it down, up, down. Okay, and again, you do 15 reps there. All right, so if you guys think after that testing, you think that it might be the piriformis, one of the best ways to loosen up muscles, any muscle, not just piriformis, is a combination of stretching as well as foam rolling, okay? So what you're gonna do is you can grab a foam roller, you can grab a lacrosse ball. What you're gonna do is you're gonna cross one leg over the other, and you're gonna just kind of roll on that glute. And you'll know, you're gonna have to search around and roll for it and look for it, but when you hit the spot, you'll know. It'll be pretty intense. Okay, it's just gonna help loosen up that piriformis muscle. Okay, and ideally we do this for about a minute or two, all right, each side. If you feel a really tight spot, you can kind of just pause and sit on it. Okay, so that's another way to loosen up that piriformis as well as the stretching that I showed you guys earlier. All right, so to recap, gave you guys 4 exercises. The cat-cow, okay, the cat-cow is the one that we're on all fours and you're doing as much extension with the back and then rounding out as much as you can. You're gonna do 15 reps, 3 sets. Other one is the piriformis stretch where you're laying on your back and you're crossing your left knee over to your right, okay, and holding for 30 seconds, 3 sets. You can do the same thing other side, obviously. And a nerve flossing, okay, where you're laying on your back and you're just bringing that foot, flexing that foot and extending it. And then also foam rolling that piriformis for 2 minutes. Ideally, you want to be doing this twice throughout the day, okay? And that should help you guys and get you quite a bit of significant relief. If you do that consistently, even just if you do that consistently for 2 or 3 days, it's going to make a big, big difference, okay? So those are things for each area, the low back, piriformis, and nerve tension, all right? So for a lot of you, that will be enough. You guys won't need any more. However, this lingers on. If you guys do these consistently for a week or two, and it gets better, but it's not all the way gone, or if it seems to get worse, what you just need to do is you need assessment with a physician, chiropractor, physical therapist, and whatnot too, okay? Don't let it linger on, right? We have so many of our patients with sciatica that have been dealing with sciatica is really probably the most chronic condition that we see, and the thing that people think they just have to live with, when in reality that's not the case. Okay, it's totally treatable, totally fixable. You just need to have somebody do an assessment on you, and somebody that can spend a lot of time doing that assessment. Okay. Um, a lot of times, if you go see a physician and the first thing they tell you is, oh, let's do an injection, um, or let's do surgery, don't go get a second opinion. Go get a second opinion. This is not something that the first course of action should not be injections, medications, or surgery. Okay, especially when physical therapy and conservative approaches can, be much safer and make a much bigger lasting difference. Okay. All right. Because you guys attended this today, you get 50% off initial evaluation. That's good for the next 24 hours. So you guys can take advantage of that. I'll be dropping a link in the comments. If you guys just want some more guidance, I'm happy to hop on a phone call with you and kind of point you in the right direction too if you have any questions um, about this today. But the main thing is, the biggest takeaway I want you guys to know is this is not something that you have to live with. This is not something that needs to be affecting your everyday life, like impacting your ability just to stand or impact your ability to walk or sit or exercise for that matter. We have so many patients that come in and like, yeah, I'd just love to be able to stand for longer than 30 minutes or be able to walk for longer than 30 minutes or be able to run again. And they get back to much more than that. We get people back to doing half marathons that have been living with chronic sciatica issues and whatnot too. So I want you guys to know it's not something you have to live with and something that's very easily fixable with the right guidance. Okay. All right, guys. Well, I hope you guys enjoy the rest of your Thursday and the rest of your week and have a great weekend. All right. Bye, guys.